Hey everyone, thanks for jumping on today. Our session today is going to be some sales training specific to hospital indemnity plans. We are going to talk about those products, how they're constructed, as well as follow the sales tips from one of our highest producing agents with hospital indemnity plans thus far this year, a gentleman named Stan from Ohio, and sort of use his expertise and his experiences to talk through how you might be able to develop your business with hospital indemnity plans. So in terms of our agenda today, I'm going to start by discussing what is a hospital indemnity plan? How is it constructed? Why should you sell them? And then we're going to talk about Stan, what his business model was probably about 12 to 18 months ago, how he then determined that working with HIP plans, standing for Hospital Indemnity Plan, how selling HIP sort of changed what he was doing, looking at his approach that was different both for Medicare clients as well as his folks on under 65 medical, talking about two different approaches for product build, going with either a basic structure or more of a wrap approach. And then lastly, but most importantly, what was the impact on Stan's revenue? How did it change his financial model in terms of the income he was generating just from that one small product line? We'll talk a little bit about available products and then finish up with information on the HIP sales guide, which will be provided to you here in the next couple of days. So first of all, let's take a look at what is HIP. Well, very simply, HIP is an acronym for Hospital Indemnity Plan, not any more complicated than that. And really what we see our agents using these plans for is usually in one of two different types of scenarios. One would be in conjunction with consumers who have Medicare Advantage plans. The other would be with individuals who are on under 65 medical, be it on individual plans, off exchange if they're ACA exchange products, or if they are still on group plans, seeing a large volume of this business being written under 65. In fact, in looking at the block of business that our agents have written over the course of the last 12 to 18 months on HIP, probably accounting for somewhere around 45% of our business. So a very large segment of the HIP that is being written by our agents is for under 65 consumers. One thing to keep very, very firmly in the front of your mind is that this is not credible coverage. When we talk about HIP, it's really as a supplementary product, something that helps to offset some of the holes that may be present in other credible coverage. But in and of itself, this is not a substitute for credible coverage like Medicare Advantage or major medical coverage. So just keeping that firmly top of mind. So what do these plans cover? Is it just inpatient hospital costs, or are there other items that are part of these plans? Well, I remember the first time, years and years ago that I looked at HIP, I thought to myself, oh, well, it just covers your inpatient charges. And there are some plans that's it. That is the full extent of what is covered on these particular plans was inpatient hospital charges. There are others that offer additional optional riders, so you can build the product that is really most applicable to your needs, your concerns, or in many cases, what's appropriate for your budget. Some of those optional riders that are available on a multitude of different products, and obviously this differs carrier to carrier, but items like outpatient rehabilitation, ambulance, there are skilled nursing facilities sometimes you will find as an optional rider on a HIP. Additionally, there are other plans that offer them as an embedded portion of the product that is built in. Now, the one thing that I would caution you on in terms of what we have seen from a sales perspective is that oftentimes the carriers who offer products with the not as riders, but significant amount of embedded benefits that you cannot remove, sometimes they struggle to hit a price point that's conducive for their consumer to purchase. So there are carriers that offer rehab, ambulance, ER, all sorts of different things as embedded portions of the product, and that gives you a lot less flexibility in terms of meeting a price point that is consistent with your consumer's concerns. So that would be one thing I would caution you on, that what we've seen from our agents is that they've been much more successful writing business with a product that offers, optional riders as opposed to an embedded benefit, so you don't have to purchase all of those if that's not really your priorities list. So we talked a little bit about what a HIP is. So why sell them? Why include them in your practice? Well, the first is specifically around client protection. And, I think that if we look at the reasons why many of us are in the insurance industry, aside from the fact that we want to provide a living for our family, I think many insurance agents feel good about helping people protect their families and themselves from undue financial risk. That's something that makes you feel good when you go to sleep at night. And a lot of times, and we've all dealt with consumers that feel this way, that clients are happy with their coverage, but a lot of times they aren't really clear on the exposure that's there, regardless of how well we've worked to explain that to them in terms of the exposure that's there with an inpatient hospital copay, or a deductible and applicable coinsurance perhaps on an individual plan. That regardless of the job and the time that we spend to explain and try to give clarity to these consumers, that they aren't really firmly top of mind clear on exactly what their exposure is. And because of that lack of clarity or lack of understanding about their exposure, they additionally don't have the funds to cover that in the event of an inpatient hospital stay. So protecting your clients would be one reason to offer a HIP plan. But secondly is the increased revenue. One of the biggest barriers to increasing revenue in the insurance industry is finding leads. I know that not only myself, but folks on our marketing team, folks that work with our agents here at Knight, Schloss & Fleming are constantly asked about leads. Where can I find new consumers? Where can I find new people to talk to? Well, the leads are great, and don't get me wrong, I love talking about leads and ways to find new consumers, but if you think about the net impact to your revenue at the end of the year, the easiest way to increase the revenue that either yourself or your agency is generating is being able to generate additional dollars without lead cost. And there's a multitude of ways to do that, obviously, depending on the product line that you're working with, but if you can generate additional dollars with your existing consumers to protect them against needs that we know that they will have, that is a phenomenal way to earn income. Because again, your net commission gain is so much higher when you don't have to factor in the lead cost to generate that sale. So additionally, some agents are marketing hospital indemnity plans to bring you leads for other lines of business. And so it works both ways. You can use hospital indemnity plans to generate additional revenue off of your existing clients, or market hospital indemnity plans to gain leads for major medical or Medicare Advantage, or ultimately work those consumers for things like life insurance or annuity products. So hospital indemnity plans in terms of increased revenue work both from a proactive and reactive position in terms of generating revenue from consumers. So let's talk about my buddy Stan. Stan is a really nice agent, and he's a great example for this type of sales training. It was really nice to share some of the things that he was doing because Stan actually, he started generating this revenue following one of the earliest hospital indemnity sessions we had earlier this year. Well, Stan lives in Ohio and works that market. And he's been writing Medicare Advantage for over 2 years. But his main source of revenue has really been individual medical. That's what we've been doing for the 10 years that he's been in the insurance industry. He added Medicare Advantage initially because he was looking at PPACA and the impact he thought he was going to have to his business, and determined, okay, I think I need to add some other lines just in case I'm not able to make the money that I feel I need to in light of the changes with the ACA law and the changes to the individual medical market. So he did that, but was still looking for additional ways to increase his revenue. So in order to find that additional revenue, he was looking for options. And one of the things that he talked to us about was finding either, first, an additional product he could use during his Medicare Advantage or ACA appointments, or something that he could go back to his book of business and work during his off season. Now, those of you that work in either Medicare Advantage or with the underage medical know that this time of year, fourth quarter, is incredibly stressful. The Medicare Advantage enrollment period just ended. Those of you that work with the major medical products know that this is still going on. So there are a lot of folks who are looking for ways to go back to those consumers in January, February, all the way through till September, and try to position products with them after the fact. So Stan was looking for something they could use in either of those two scenarios. Well, he ended up attending one of our sales training sessions that we did in late spring, early summer, and decided he was going to start doing HIP during his appointments. Initially, he started doing it with his turning 65 consumers over the summer, and has since continued to work with that through open enrollment period. And after talking with our marketing team and really working with them on understanding how to sell the product, what were some key priorities, he came up with his 4 key thoughts in terms of being successful with these products. And those were, first of all, making it a part of every one of his sales presentations, determining if you don't ask about it, they won't ask you, know what questions to ask your client, and lastly, know how your product fills their needs. Let's talk about each one of those. His first key thought, make it a part of every presentation. Well, Stan knew in looking at his business and the things that over the course of his 10 years of being in insurance that he was successful with, he realized in looking back that the only things that he had really been successful with, and every once in a while, you can kind of dabble in something, and maybe you decide for a couple months that you're going to add short-term care to what you're talking about, or maybe you get a dental product that you spend a little time on. But when Stan really looked back at the last 10 years, he determined that the only products he had been really, truly successful with in both helping his consumers and generating revenue were things that he was committed to, that was a part of every single sales presentation, so that he knew it backwards, forwards, and sideways. So the first thing Stan determined was he had to make hospital indemnity presentations part of every sales presentation he made, whether it was Medicare Advantage, ACA plans, or anything else that he was doing. That was going to be a key portion of what he talked to consumers about. The second thing he figured out was if he didn't ask the consumers about the hospital indemnity plans, they certainly weren't going to ask him. And he thought about the sales presentations he had with his clients, the type of questions they asked him, and then additionally, what is it that they retained, interpreted, and then came back to him on? What were the questions that they asked him after having a product or having some consideration? And he realized that there were very, not easy, but sort of basic concepts in insurance that a lot of his consumers struggle to grasp. And understanding this, he realized that expecting his clients to ask him about hospital indemnity plans or that type of exposure wasn't a reasonable assumption. That if he, as the agent, did not ask the consumer about hospital indemnity or that exposure and how they planned on covering it, they were not going to initiate that conversation with him. So he had to be the initiator in terms of that subject. So he then determined, okay, I've got to ask the question. Every appointment, I need to ask the question of my consumers. And he started out by asking the question, would you like to purchase an additional hospital indemnity plan? So just think about that in your mind. Think about your sales presentations either in Medicare Advantage or with ACA products under 65, or even working with your consumers who have purchased group insurance through you. How successful do you think Stan was using that lead question of, would you like to purchase an additional hospital indemnity plan? And what do you think? Well, can you use the words epic fail? Well, I can, and that was actually what Stan had said to us when we talked to him about a month into his program, that question was not resonating with his consumers because they didn't determine the need for the hospital indemnity plan. They heard that question and thought, No, I don't need a hospital indemnity plan. You just sold me insurance. I have other coverage that's appropriate. And really, after getting the response that no, my insurance is appropriate, I don't need that, he really didn't have a next question to ask to generate that better sales discussion. So he realized he needed a new set of questions in order to really start generating revenue from that product. Lastly, Stan needed to know how his product that he was planning on using filled the need. You know, it goes without saying that you have to understand your product. You know, that's very important as an insurance agent. You have to understand both the ins and the outs of whichever product you were planning on leading with. And the three things that Stan focused on, and you know, there are many areas to any insurance product, but the three key things that he focused on were price point, benefit flexibility, and lastly, underwriting, knowing that if you couldn't get a consumer into the product, it really wasn't worth anything at all. Now, the other thing that Stan realized was that the approach that he needed to take with both Medicare Advantage and ACA clients needed to be different, that it wasn't a one-size-fits-all in terms of how the product was positioned with each of those consumers. Now, granted, both of them had health insurance, but a lot of it had to do with the fact of how were the benefits structured on an MA plan versus how are the benefits structured on a typical ACA exchange or underage medical product. And what he realized was with MA plans, most of the products that are available in his market in Ohio had daily hospital copays, you know, of varying sizes. Some were at $200, $300, $400 per day, but they were usually working with daily hospital copays. Now, his exchange consumers that he was working with were built differently. It wasn't a daily hospital copay. They had a large upfront deductible of varying sizes, and then that was then followed by coinsurance. So it was really a different approach to filling that need, was the determination that he had made on the difference between both MA and ACA business. So Stan then took some of the questions that he got from our previous sales webinar that we had done and kind of used that as a starting point for what he was going to do from a sales scenario. So he came up with four kind of key questions. You know, the first one, he would ask the consumer, if you needed to go to the hospital, which hospital would you go to? He then used the second question to establish the cost. He would say, did you know that the average inpatient stay at that facility is X number of days? And he's using data that he acquired, and you'll see that in the Hospital Indemnity Sales Guide, how to find that information. But he would determine, okay, you know, the hospitals in the area, say he was looking at Cleveland Clinic in Stan's market. The average hospital stay in that facility was a certain amount of days, and then inform the consumer on your plan that you're on. And then he would define the projected amount of the hospital stay. We'll go through a scenario here in just a second. He'd then ask a question to define the need. He'd ask the consumer, is that an amount you'd be comfortable paying at a moment's notice? And then lastly, he'd provide an alternative, letting them know, I can show you how to protect yourself from those expenses. Are you interested in seeing it? So again, he then had to take a different approach at that point. Once he had established the need, you know, with the Medicare Advantage clients, putting together an offer that was built around a daily hospital benefit that very closely matched up with their current plan exposure. And with the ACA consumers, looking at a lump sum indemnity benefit that would match their deductible. So again, slightly different approach with each of those consumers, really kind of depended upon the benefit build of what that consumer was working with, but ultimately, once the need had been defined, just a small divergence in terms of the approach of building that benefit for the consumer. So here's an example of Stan's approach with a Medicare Advantage client, and we'll assume that he's talking with Mrs. Smith. Mrs. Smith, did you know that the average inpatient hospital stay at Cleveland Clinic is 4 days? Under the Aetna plan you have now, a 4-day hospital stay would cost you $1,100. If you had to pay that copay, can you conveniently come up with those funds at a moment's notice? Would you rather pay that $1,100 or look at a plan to cover that amount for a small monthly premium? That would be an example of his approach with a Medicare Advantage client. With an ACA consumer, Stan might approach it this way. Mr. Jones, did you know that the average inpatient hospital stay at Mercy Hospital is 5 days? Under the ACA plan you have now, a 5-day hospital stay would trigger a $1,500 deductible. You would also pay 20% of the charges up to your out-of-pocket limit. If you had to pay that copay, can you conveniently come up with those funds at a moment's notice? Would you rather pay that $1,500 or look at a plan to cover that amount for a small monthly premium? Here's the thing, you're also not done yet. You would establish the need for the hospital plan, and Stan had also determined that some of his consumers, aside from just covering that hospital benefit, sometimes had the appetite to maybe cover some more of those items, like we had talked about those flexible benefit riders. Now, here's an example of going with either a basic approach or a wrap approach, and then we'll show you how this plays out in an actual sales situation. So under a basic model, Stan has a 68-year-old female in Ohio on a Medicare Advantage plan for $275 per day. So on the basic approach, Stan offers a hospital indemnity plan that covers $275 a day for 6 days. And the cost on that, all by itself, no additional riders, $22.55 per month. Basic approach. Now with the wrap model, in talking about some of the other some of the other riders that are available, approaches this consumer. They have the $275 per day copay for 6 days. Stan offers a hospital indemnity plan with not just the $275 per day inpatient, but also some additional riders, $250 towards ambulance, $50 per day the first 20 days in a skilled nursing facility, $100 per day, days 21 through 100, as well as $5,000 of first occurrence cancer coverage. And the price on that product would be $53.99 per month. So 2 different models, 2 different approaches, giving the consumer the ability to determine what is and is not necessary in terms of what their priorities are. So here's a scenario of a hospital stay that Medico had created that I thought was really applicable and kind of speaks to the value of this wrap style approach. So the scenario for this particular example is you have a Medicare Advantage PPO, 67-year-old female that has a stroke or a broken hip, something that would result in about 45 days in a skilled nursing facility. So in terms of the exposure for the consumer, just so that we've got our minds around what it is that they would be responsible for paying, they would spend 6 days in the hospital. So cost for that consumer, $265 per day over 6 days, gives you a total charge on inpatient at $1,590, just short of $1,600. There'd be a $350 charge for the ambulance, which would be transport from the inpatient facility to the skilled nursing center. Consumer spends 45 days in the nursing facility. First 20 days covered at no cost by the Medicare Advantage plan. The second 25 days, days 21 through 45, would be billed at $140 per day for a total cost of $3,500. So under the Medicare Advantage plan, with this particular health situation, the consumer would have a total out-of-pocket expense of $5,400 and change. So here you have someone who has legitimate health insurance, it's credible coverage, has a health occurrence that isn't ideal, and now all of a sudden is out of their pocket for almost $5,500. So let's take a look if this consumer had that hospital indemnity plan, that wrap style build of their plan, as showing an example of why someone would enroll in that type of product. So if they had that plan with $275 per day for 6 days, that would pay out at just over $1,600. They had the ambulance rider at $250 per occurrence, give them $250 bucks. They added $50 per day of skilled nursing facility coverage. So for those first 20 days in the nursing facility, they net out $1,000 in benefits. For the next 25 days, days 21 through 45, they had purchased $150 worth of coverage. That would pay them out over $3,700. So with this policy, they would receive a check from Medico for over $6,600 and basically net out in terms of the cost, the copay cost on the Medicare Advantage plan versus what they received from the HIP, they would net out ahead $1,200. Now, the premium on this plan, looking at what it would cost through Medico, would be about $42.19 a month. So you've got a total premium cost over the course of the entire year of $506. For that consumer, even accounting for the $506 in premium costs for the whole year, this whole extravaganza that they've gone through between the hospital stay, the ambulance, the skilled nursing facility rehab, with having this Medico hospital indemnity plan in place, they would net out ahead $700. Now, I don't know that anyone wants to break their hip and spend 45 days in a nursing facility to make $700. But what a relief to this consumer that they would, instead of being out of their pocket $5,400, they are actually $700 ahead. So that's something to keep in mind as a reason why someone would want to build this type of product to be able to cover their needs. All right, so the portion that I know you're all very, very interested in, how much, all of those things are good. Helping your consumers, filling their needs, making sure that they're covered, all great. What can you make as an agent? Well, in looking at Stan had said that his goal was to write 2 hospital indemnity plans each week. So basically, he had talked about writing 8 of these plans a month. So if you look, and this is just simply with a basic approach where you're doing, and the example we used to create this was a $250 per day for 6 days, no riders added, very simple hospital indemnity plan that comes out to a premium rate of about $21.80 per month. And using this example, writing 8 per month, which is 24 per quarter, which is 96 hospital indemnity plans per year, which based upon the book of business that Stan had in place both with Medicare Advantage and with his ACA business, he is still on that pace, would result in a first-year commission, additional commission dollars of almost $14,000. And at his renewal level that he's making, that would come in just around $3,000 per year, assuming that he had a 90% persistency rating. Now, something to keep in mind is that when we look at the average premium that our agents are generating in terms of their hospital indemnity sales, be it with Medico or with any of the other products that we have in different markets, the average price point of what our agents are selling is somewhere north of $40 per month. So we're seeing probably about an equal split of that wrap style approach as we are to a very basic approach. It's really about what is the consumer's threshold for premium, what is it that is top of mind in terms of their needs and concerns in terms of their exposure. So dollars can be very significant. In looking at the average premium numbers that our agents are generating, I would expect that Stan will probably top out his 12-month plan somewhere north of $25,000 in first-year commission, which certainly is a real nice addition to what he's been generating with his Medicare and underage medical business. So one of the products that we really like is the Medico hospital indemnity plan. It's probably been our leading product in terms of sales over the course of 2014. We've got some other products that we're writing, but Medico is really the one that our agents are choosing to write more often than not. Now, it's currently available in 35 states, and that was as of September 1st. And it's built with those optional riders. If you want to go with a basic approach where it's $250 per day for 6 days, done, fantastic, the end. Great price point in the low 20s in most states, very accessible for most consumers to come up with those dollars and fill the need. Additionally, when you put in the other riders, those riders are fairly inexpensive. They're generating really good value for the premium dollar as well. If the premium is higher, what else is higher, boys and girls? Premium is higher, commission is higher. So that's something else to consider. But it gives you that flexible benefit structure to hit exactly the price point that the consumers are comfortable with. And it also has online enrollment. I can tell you from personally using the My Enroller tool, it is a great way to try to write business on an iPad, using your laptop, or even if you're doing it from your own office. We have several call centers that are set up to utilize the My Enroller tool as part of their call center process and are working both their Medicare Advantage books as well as their underage medical books that generate lots of premium dollars. So significant dollars are out there based upon whether you're a personal producer that sells at the kitchen table, whether you have an office, an agency, or a call center. This product fits very nicely there. So a great product with Medico, probably like I said, our lead product over the course of the last 12 months in terms of what we've been selling. They do a really nice job. Now, in terms of our sales guide, one of our marketers will be calling everyone who's on the session today. We'll be calling you tomorrow. They're going to send you the new hospital indemnity plan sales guide that we built in conjunction with Stan. And they're also going to talk to you about products that are available in your market. So if starting to write hospital indemnity plans is something that you'd like to try now that Medicare Advantage enrollment period is over, or you're looking to start to build this as part of your business model moving forward after January 1st, we'll be able to help set you up to do that. At this time, we're ready to take some questions. Through the WebEx panel, you've got both a chat tab as well as a Q&A tab. Happy to answer questions for you. Obviously, your phone lines are not live, but any questions that you submit, I'll be happy to take them. So at this time, again, any questions you have, you can submit through either the chat tab or the Q&A section, and we'll be able to get in there for you. All right, let's take a look here. First question, is New Jersey approved by Medico? Well, I can tell you it's not currently approved in terms of the hospital indemnity plan with Medico. One of our marketers will talk through whatever plan options we have in the state of New Jersey. I do know, and as part of our last call with Medico, which was actually this morning, our national distribution call, that they are in discussions with the state of New Jersey on a couple of different products. Now, obviously, I have no way to project approval dates or whether indeed that will move forward, but I know that they are engaged in discussions with the state of New Jersey on some products, so we'll have to see how that plays out. Next question coming from Deborah. Do you need a health license to market this product, and is Virginia approved? We do have product in Virginia. Medico has a host of products available there, and I do believe that a health license is absolutely required to market these products. Question for Michael, is the product available in Ohio? Yes, absolutely it is. That's where Stan's being so successful in terms of the hospital indemnity plan. So that's actually where Stan's from. You might actually know him, but he's in the northeastern Ohio market, but it is approved in Ohio. I believe it was available mid-year there, so they're doing quite well there. Next question from Greg asking about California. Medico is currently not working in California at all. I do believe we've got other hospital indemnity plans that are available in the state of California, and that's certainly something our marketers can go over with you at that point in time. All right, so here's a question from Ron in North Carolina, and he's asking that I guess we had talked a lot about the daily benefit and how to utilize that, asking a little bit about, excuse me, how to utilize the hospital indemnity plan with under 65 folks and really how that approach is different. In looking at the under 65 approach, the pricing is a little bit different. It's fairly consistent, but really you're buying, and I'll use Medico as an example. You're going in with more of a lump sum approach. So what Stan has done with most of his medical cases, and a lot of our agents do this too, is as opposed to going with a daily benefit, Medico has a second option called option 2, where you can pick a $1,500 lump sum that will also reset 3 times per year. But you could go in there, you've got your first occurrence on your hospitalization, $1,500 pays out in a lump sum, and then that's really the approach that usually you go with there. And we can certainly talk about that, either talking with our marketers or talk offline about it. Question here from Michael. Do you feel that the best prospects for this are over 65? I actually don't feel that way. And again, in looking at our experience with what we've been writing over the course of the last 12 months, it's really been about 55% over 65 and 45% under 65 in terms of the sales volume. So I think these types of products are really equally as important for both segments of the market. I think that, in fact, in terms of the sales of ACA products, that hospital indemnity plans have really benefited from the structures that have been put in place over the course of the last 2 years. So I think it's just just as attractive to consumers on both sides of that age 65 dividing line. It just depends upon the types of consumers you're working with. Okay, here's another question from Bonnie. How strict is underwriting? Well, the comparison that I would give you is I think that the underwriting for hospital indemnity plans is probably a little bit easier than Medicare supplement underwriting. So, if you look at underwriting for a middle-of-the-road Medicare supplement plan, it's a little bit easier than that. So that's sort of a comparable, but we can certainly get some applications in your hands to take a look to see what it is that you feel you can really do. But the underwriting is not significantly difficult. Like I said, in fact, I think it's a little bit easier than your conventional MedSup product. All right, with that, I'm not seeing that we have any other questions. Again, if you have any other questions, you can certainly give us a call here at our office. Phone number here, 800-562-7733. We're certainly happy to hear from you at any time. Our marketers will additionally be giving you guys a call tomorrow, hooking up with you on the Hospital Indemnity Plan Sales Guide, as well as going over applicable products in your market. I want to thank you very much for taking the time with us. I know everyone's very busy. Your time is very valuable. I want to thank you for your partnership in your business. And please don't hesitate to reach out to us if there's anything that we can do for you. Thanks again, and have a great rest of your day. Take care.